Good evening and welcome to the COVID-19 pandemic update. I'm Kayode Okikelu. First, the highlights. Airport officials set to enforce travel ban on passengers coming in from India, Brazil and Turkey to stem a surge of the virus here. And Governor Dapo Abiodun appeals to Ogun residents to take advantage of the ongoing vaccination exercise. And UK delivers 50 million coronavirus vaccines just as EU looks to open up international travels in 2 weeks. Well, first we say a happy holiday, or at least what's left of the day, to all Nigerian workers out there and to the frontline health workers who may not have the luxury of a holiday, no thanks to COVID-19 and other health exigencies. Thank you for the sacrifice. Well, COVID-19 clearly isn't going on a holiday just yet, with the latest figures released by the NCDC reminding us that the battle is still on and we must collectively win this. Well, here's a breakdown of the latest COVID-19 infection rates in the country.
Daily infections count in Nigeria has remained relatively low in recent times. Last night, the country recorded 28 new coronavirus infections, a drop from the 43 infections recorded in the previous 24-hour cycle. The new cases were reported from 7 states and the Federal Capital Territory, FCT, including Lagos, which recorded 14 cases, while Osun, Ogun, and Kaduna states recorded 3 cases each. Akwa Ibom confirmed 2 cases, while Abia, Kwara, and the FCT recorded 1 case each. The new figure has raised the total number of infections in the country to 165,181. The agency reported 0 deaths from COVID-19 related ailments as it was in the previous 24-hour cycle, leaving the fatality toll in the country at 2,063. 252 persons have been discharged, including 248 community recoveries in Kwara State, managed in line with guidelines, raising the total number of recoveries to 155,361. Nasarawa currently accounts for the highest number of cases on admission with 1,996, followed by Ondo with 1,105 cases and Lagos with 1,051 cases. So far, the active cases in the country stands at 7,743. More than 60% of Nigeria's target population have now received the first dose of the Oxford AstraZeneca vaccine, according to the latest update by the National Primary Healthcare Development Agency. Out of a total of over 1.2 million eligible Nigerians, Lagos is still leading the chart after vaccinating more than 200,000 of its target population. Lately, hospitals, morgues, and crematoriums in India have been overwhelmed, as families have been left on their own to scramble for medicine and oxygen, with dozens of people who've died in the past 1 week. India now ranks 3rd in countries with the highest number of fatalities in the world. Globally, over 152 million confirmed cases and more than 3.2 million deaths have been reported.
In less than 6 hours from now, travelers from India, Brazil and Turkey, or anyone who has visited these countries in the past 14 days, will be denied entry into Nigeria. And any airline who fails to comply with this new travel restriction will pay a penalty of $3,500 for each defaulting passenger. The Presidential Steering Committee on COVID-19, chaired by the Secretary to the Government of the Federation, Mr. Boss Mustafa, announced these new measures to minimize the surge in COVID-19 cases after carrying out a risk assessment of countries with high incidence of cases. Well, the only exception, however, are Nigerians or those with permanent resident permit, as well as transit passengers who shall undergo 7 days of mandatory quarantine in a government-approved facility at the point of entry, with strict enforcement of existing travel protocols. All eyes are now on officials at various entry points to enforce these interim guidelines, which will be reviewed after 4 weeks. Well, there's a growing concern about the attitude of Nigerians towards adherence to COVID-19 protocols to control the spread of the virus. In Akwa Ibom State, at the popular Ibom Plaza, majority of the people there, When you see adherence, you see that there's much to be desired, with majority of people seen without face masks. But that's not all. In this report, our correspondent in Uyo, Akwa Ibom State, has more.
According to information from the Akwa Ibom State Ministry of Health and the Office of the State Epidemiologist, a total of 1,864 persons have so far been infected by the virus in Akwa Ibom State.
Actually, for this first phase of vaccination that we have done, I've seen a large number of people coming out on by themselves requesting to be vaccinated. So I'll say for the first phase, which was supposed to be for health workers, I'll say that the response has been very, very okay.
So far, 1,830 persons have been treated and discharged, while the number of active cases stand at 20. Till date, over 25,000 people have received the AstraZeneca vaccine in the state. A visit to the popular Ibom Plaza, arguably one of the busiest parts of Uyo, shows that a greater percentage of the population are seen without face masks and physical distancing, almost non-existent. Some members of the public speak on the situation.
COVID-19 is not a disease that one should joke with. I'm not praying to have it, but from the literature and other things, messages, one has to protect himself or herself. For example, this is my own sanitizer. I go about with it. People may laugh at me, but this is me. I have to go about with this. I have to go about with face mask. I distance myself where people don't wear it. If I want to greet anybody, I just boot, and that's all.
People thought that the sickness is no more here. The sickness has not been reached. That is the belief of so many. But to me, I don't want to believe that.
The current situation calls for more concern, and every citizen of the state must ensure adherence to avoid situations that may lead to more infections as a result of non-compliance.
While Lagos State, the epicenter of COVID-19 in Nigeria, continues to brace up for a possible third wave, the government says it is not taking its eyes off other health issues affecting residents, particularly HIV and AIDS infection. The Chief Executive Officer of the state's AIDS Control Agency, Dr. Mansurat Adeleke, says the government has approved the scaling up of care for those infected with the virus. It is also working towards achieving the joint United Nations program on HIV and AIDS target by 2025 of caring for 95% of the population.
Basically, our theme for the World AIDS Day last year in December was that we'll continue to fight to end HIV amidst the COVID-19 pandemic. I want to believe that Lagos State was one of those that will continue to do that despite the COVID. We screened the second highest in Nigeria last year, with over 500,000 people knowing their status, even despite the COVID-19. So I think that in tandem with the United Nations initiative, where it is 95, 95, 95, which pretty much says that 95% of people must know their status, 95% must start antiretroviral therapy, and 95% must achieve virus suppression. I feel that achieving the first 95 by screening second to the highest shows you that it was a very strong HIV and AIDS response despite COVID-19 pandemic.
And a neighbor in Ogun State, where Governor Akwa Ibom is asking residents to get vaccinated to reduce the effect of the pandemic and community transmission as the state takes delivery of more vaccine doses. Governor Ibom made the appeal while hosting the leadership of labor unions to the break of fast in Abeokuta, the state capital. He asked the unions to mobilize residents with the assurance that the vaccine is safe. Ogun State has so far administered the first jab of the AstraZeneca vaccine to over 60,000 residents.
So I want to admonish you that if you have not been vaccinated, please be vaccinated. Because let me tell you, you may not believe in it. You may not say maybe it doesn't work. You know, it's like saying maybe there's no heaven. There's no heaven. There's no hell. So because of that, you will live irresponsibly. And then you pass on to the beyond. You now get there and find out that there's really a hell. So what do you do now? You don't enter one chance. So in this case, either you believe it or not, take it. Science has proven to us that if you're vaccinated, it may not stop you from contracting the disease, but it will definitely stop you from dying from it. That is enough. That is enough. So please, let us ensure that we are vaccinated, so that this would have done our own part.
Well, aside pharmaceutical solutions, one of the 5 precautions to lower the risk of COVID-19 infection is cleaning of the hands. Perhaps inadvertently given some bite to that expression, it's in your hands. Incidentally, the world will be commemorating Hand Hygiene Day, and the message this year is seconds save lives. Clean your hands. Well, let's talk about that aspect of this fight against COVID-19 and more. Dr. Olaolu Aderiola is the head of Response Division at the Nigeria Center for Disease Control, NCDC. He joins us from Abuja studio. It's great to have you on the program. But I'd like to begin with this new travel restriction, if you may. Let me just ask you, are you confident, really, first, with the manpower we have at the entry point, and how effective this will be in curbing a possible surge?
Thank you for having me. Yes, there are concerns about this, but we can see that government has been working hard to ensure that we reduce the risk of any importation of new strains into the country. We'll try as hard as we can, and we believe that with the good work that has been done at the point of entry manned by the Port Health Services of the Federal Ministry of Health, they'll continue in this task to ensure that there is strict monitoring of those who come in and adherence to this. If we do this, this will really help to reduce the risk, to minimize the risks quite significantly. And this is what the country has been doing, and we are very confident that the manpower will still continue the work they are doing. And government is also looking at how to really help in ensuring that compliance is done, and the health workforce is being supported to be able to get this job done.
You know, the peculiar thing about this fight against COVID-19 is the fact that the battle is being fought on different fronts. You have vaccination drive, you have the talk about travel restrictions, but let's talk about the non-pharmaceutical means. Now, we may take this for granted. I mean, it's been over a year and we've been saying the same things. Wear a mask, keep physical distance, open windows, clean your hands and all. So let me just ask you, at the risk of sounding like a broken record, just how much do these measures work in protecting against the virus?
So the non-pharmaceutical interventions really work a lot. It might look simple, but they are very effective. We are currently looking at World Hand Hygiene Day, which will be marked on the 5th of May, and NCDC also joins global partners in this. It's been shown that hand hygiene helps to reduce about 50% of infections that is transmitted, either respiratory or oral or fecal-oral. And this has really shown that, it has also shown that it reduces the returns we get on savings on implementing this is about 16 times of this. And we also know that prevention is always better than cure. So the slogan of this year, Seconds Save Lives, is just very apt, because just taking that action really helps a lot. You know, cleanliness is next to godliness, and doing those simple things really help, and it breaks the chain of transmission of infection. So it may seem very simple, but it's a behavioral issue. It shouldn't just be something that we do when an outbreak occurs. It's something that needs to be done constantly by healthcare workers and the general public to ensure that our hands are clean, and other interventions are made, the physical distancing, the wearing of the mask. It has really saved so many lives, and it has reduced, it has been able to break the chain of transmission in the country.
And we do hope that the NCDC can properly drive, these points home, and maybe tweak that to cleanliness is next to wellness as well. Well, I'd like to thank you so much, Dr. Olaolu Aderiola, who's the head of Response Division at the NCDC.
Thank you.
South Africa has received the first batch of Pfizer COVID-19 vaccine to boost its vaccination program. The doses will be received every week, with a total of 4.5 million doses expected by the end of June. South Africa resumed vaccination using the Johnson & Johnson vaccine that had stopped being administered over reports of blood clots elsewhere. The country has vaccinated over 318,000 people, according to data from the Health Ministry. It has so far recorded over 1.5 million coronavirus cases, including 54,417 deaths. Well, for more analysis of some of the global COVID-19 trends, let's speak with Dr. Olufemi Oyeka, a physician in Essex. It's good to have you on the COVID-19 update. Well, we just saw South Africa taking delivery of the Pfizer vaccine, and it looks like that will be the next trend for African countries, seeing that Nigeria has also approved it for emergency use. But let's talk about the UK first. The UK has just delivered its 50 millionth vaccine in 5 months. So that's an average of 10 million doses per month. It sounds like a piece of cake, but it wasn't exactly a walk in the park, was it?
Absolutely, absolutely not. Well, first, thank you for making me part of today's discussion. I'll be very candid with the situation of UK, to be precise, that there was credible information dissemination, and the entire country was aware that the only pathway to get business, life, every other aspect of daily activity back to normal was for everybody to make themselves available for the COVID vaccine. And we also know that the temporary measures like social distancing, face mask, and hand hygiene were not definitely going to be the game changer. So that was why you see that, to be very honest with you, there was mass training of staffs, nurses, pharmacists, doctors that had to make themselves available to deliver the jabs. And this was one of the key cornerstone that led to the tremendous achievement of 50 million people having the vaccine in about 4 to 5 months.
I mean, just looking back at December when we saw the first jab administered to that elderly woman just back then, and now 50 million. But when you look at this, the way the UK approached the vaccination drive, which you have largely talked about, what would you say was most significant for you in achieving this success?
I think it was more of community response, more of people believing in the government. People believed that their government was for them, and that this was the government of the people, by the people, and there was nothing like maybe there was a cabal that was trying to use the vaccine to guinea pig, you know, this kind of sideline theories, guinea pig, all those didn't, that didn't exist here. People understand that the government was supposed to serve the people. And when the government says that this vaccine, even though we are not 100% sure about the what's going to happen, but these vaccines can most importantly stop the deaths from going on. It can so in a way, people were willing to make themselves available for the trial, for even to get themselves vaccinated, and to a very large extent. It's more of cultural thing here. It's more of cultural, where anybody that is ill, the first thing to do is to consult your doctor, consult your health expert. That's a very big difference in terms of what happens in Africa or in Nigeria, to be precise. When a Nigerian is ill, you would have tried maybe the traditional means, the spiritual means, pastor. That's, I don't know if you know what they call babalawo or something like that, but those are not very prevalent here, but those are means that they would have tried before coming to the health expert, which is usually the last resort. And by then, usually the situation is very, very unsalvageable. But here is different. So that's why you see that even like, let me add this. In Malawi and South Sudan, as of yesterday, the vaccine that WHO helped to procure to give to these countries have expired, and they had to throw it away. Why? Because people didn't go out to take it. People didn't believe that the vaccine was going to save their life. People didn't believe that that coronavirus in itself existed. So all of these discrepancies, and these are not peculiar to Malawi or Sudan. It's just the same umbrella in Africa, where there's a lot of doubt there. And the most credible and important factor is that there's a significant disconnect between the government and the people, which is why you see a very, I'll say, huge drawback in terms of response to health measures in helping sure that the coronavirus situation is totally wiped off.
You know, I know there are plans to resume international travel and even stop social distancing. I know as a health worker, you might be wary of these measures, but we definitely wish you the very best. Or you know what, let me just ask you what you think about that. So the UK is planning to resume international travels from May the 17th. You see social distancing to be jettisoned by June the 21st. So let me just ask you point blank, as a health worker, are you wary that maybe this might mean more pressure on you if the cases begin to rise again?
I'll say, to be candid with you, I'll say no. Why am I saying that? Because there are facilities here that will ensure that everybody that comes into the country is accounted for. A large proportion of people that come into the country is accounted for. And by the time you arrive at the airport, you have been identified, and there is this track and trace app that everybody logs into. So eventually, if there is a hot spot somewhere, or there is a case somewhere, people try to keep that in a form of a bubble where people are not, that bubble is going to be put under control so that the virus itself does not go outside that bubble. So these are some of the things that the government have successfully put in place, and also the fact that a large population of the country is now vaccinated. So it's unlikely that if somebody comes now with possibly an active case, it's not going to have that wildfire approach that happened maybe last year or earlier in the pandemic. So that's almost totally eradicated. And the funny thing is, like, it's not just in UK here. There are a lot of varieties of the vaccines that have been made available, and even there's also now trying to juggle one vaccine, and the other.
So you know, Dr. Femi, I see I just opened a new vista of conversation for you right there, but hopefully we'll pick this up some other time. But I'd like to thank you so much, Dr. Olufemi Oyeko, a physician joining us from Essex in the United Kingdom.
You're welcome.
Well, staying in the UK, Prime Minister Boris Johnson says there will be some foreign travel allowed in about 2 weeks. We'll give details this week on how and when international travel from England can take place. Well, this comes as a group of members of Parliament call on the government to keep travel rules in place beyond mid-May. Meanwhile, the UK has delivered 50 million COVID jabs, according to the Health Minister. Here's a global update.
Entering the EU. This will allow member states to act quickly.
The European Union is proposing to ease restrictions on travels to the 27-member bloc as vaccination campaigns keep gathering speed. The EU's executive arm says it wants to allow entry to the EU for non-essential reasons, not only for all persons coming from countries with a good epidemiological situation, but also all people who have received the last recommended dose of an EU-authorized vaccine. Officials who believe that the vaccination campaigns will soon be a game-changer in the fight against the deadly virus. Meanwhile, travelers coming to Germany from abroad who are fully vaccinated against COVID-19 should be exempt from quarantine on entering Germany. After the government cabinet discussed plans to lift restrictions for people who have had their shots, German Health Minister Jens Spahn said today that fully vaccinated people will no longer need proof of a negative corona test to enter the country. Exceptions to the loosening of the regulations will apply to people coming into Germany from high-risk areas where virus mutations are still high. Over in Spain, a soldier has died from a blood clot after receiving the AstraZeneca vaccine. Spanish Defense Minister Margarita Robles delivered the news today, saying medical reports we have been given seem to show that there is no doubt that the cause of the soldier's death was the administration of the vaccine. 35-year-old Francisco Perez Benitez was a member of an infantry regime stationed at the Aizoen barracks in Navarre, northern Spain.
don't forget to protect yourself. The virus is still very much out there. Continue to take responsibility. And of course, visit our website, channelstv.com, for more updates and a better understanding of the pandemic. We also have all the big stories from politics to business, sports, and so much more, all at your fingertips. Well, that's the COVID-19 update. Thank you for watching. I'm Kayode Okikielu.